Hey everybody, it's Dr. Dave, Psychiatry. Thanks for being here today. Thanks for subscribing. Please leave comments if you have them. Today we're talking about Attention Deficit Disorder, ADD, ADHD. Really big topic, and it's a topic for different reasons. Obviously, it's a brain chemistry problem. We'll talk about what type of brain chemistry problem it is and how we take it, how we approach it. But it's also, and I think in some ways, a societal issue. I've seen in my 30 years of being a psychiatrist that there are times in the news where people talk about ADD is wildly underrecognized and wildly undertreated, and we need more people to help for it. And then 6 months later, there's ads about, or there's articles about doctors are prescribing too much medicine for ADD, and it's too much, and we're trying to medicate all of our children, and there's a lot of social discussion around ADD and ADHD. And I think sometimes that clouds what people really need. If you're suffering from it, it just causes problems. It's like having blurred vision and needing glasses. That's the best analogy I come up with people with ADD is that when we get them on the right medicine, sometimes they say things like, man, it's like I can see clearly. I remember very, very much when I was a kid, I had terrible eyesight, and in first grade, I didn't do well. And by the time first grade ended, somebody figured out that I couldn't see the chalkboard because I have literally 2400 vision, which means when they test my vision without my contacts, they say, which way is the E pointing? Up, right, up, down, left. And that's how they test my vision without my contacts. So the good news is somebody invented glasses and somebody invented contacts. So I can survive in modern society. I sort of think sometimes if I was born in the caveman days, I would have gotten eaten by the cheetah by the time I was before I was in caveman grade school. So the point is that I know what it's like to not be able to see clearly. And the miracle of being able to see the board was something I will just never forget. And when people come in to see me and after a week of being on the right medicine, they say, I can't believe I can see clearly. Well, this is one of those where if there's any reason to raise your hand and say, I need help, this is it. Attention deficit disorder is a big one. Let's talk about the names for a second. Technically speaking, when psychiatrists or psychologists talk about ADD, some people like to talk about the difference between ADD, attention deficit disorder, and ADHD, attention deficit hyperactivity disorder, as if they're really different. And I think it's important maybe for some people to make a distinction, but in my world, it's really not. Because in my world, both of those conditions and the other one that we call combined type or mixed type, which basically says it doesn't really have to be either one, which is the one that I prefer. It is chemically, it's based on one thing. As far as we know, it's based on one thing. So I'm just going to pull out a piece of paper here and describe for you the real simplicity of it. As you know, I'm always going to start with the two lines, the high and the low, to describe the normal range. So we're talking about the chemical norepinephrine. It's made by a gland in your brain, abbreviated NE. So if you have low norepinephrine, medically, that is the cause of what we call attention deficit disorder. The reason I say that so clearly and so confidently is that medicines that boost norepinephrine, like Ritalin and Adderall, two of the major tools that we use that you might have heard of, that's what they do chemically. They boost norepinephrine. So in typical troubleshooting fashion, all I'm saying is that if you have a condition that responds to medicines that push up norepinephrine, then low norepinephrine was your problem. That's troubleshooting logic. It's very simple. When people, a lot of times, they start taking a low-dose Adderall or low-dose Ritalin to get started, sometimes they feel better the next day. So this is one of those where we have complete turnarounds. And as I said earlier, these are the ones where people say, why didn't I do this sooner? Sometimes it's because medicines like Adderall and Ritalin have a bad reputation. And the reputation is based on television shows like Breaking Bad, where people are drug abusers and do bad things, and people get hurt and people die. And it's around this idea of stimulants or amphetamines. First of all, why are these medicines, why are Adderall and Ritalin even called stimulants? It's an interesting question. If someone they're spaced out, they can't focus, they can't concentrate, and sometimes they're hyperactive, they're racing around, can't figure out what to do first or next, and it's causing them problems, why would a medicine called a stimulant help them? Well, really, the word stimulant is a very, very old term, and it's called a stimulant because when they were first testing the amphetamine groups and the medicines that pushed up norepinephrine, well, they stimulated normal people. So a lot of people that took these medicines when they were first being tested, their norepinephrine wasn't low. It was normal. What happens when you push something high when it's already normal? Well, when you push up norepinephrine, Bugs Bunny exclamation points, your norepinephrine goes too high, it causes a problem. What happens? Jittery, jumpy, nervous, overstimulated. So as a class, these medicines became known as the stimulants. But it's really confusing because a lot of people calm down when they take norepinephrine boosters. That's why I try to not call them stimulants. There is a term that I use. They're called release agents. That's what I call them, because what they do is they cause norepinephrine to be released from the ends of the nerve cells. They don't increase the production. They just cause the nerve cells to spit more norepinephrine out. And that's how they work. So if you give a norepinephrine booster to a quote normal person with normal norepinephrine, then it causes problems. And that's exactly where we have problems with Adderall and Dexedrine and Vyvanse and medicines that people abuse. And here's what it is. And you might have seen this in Breaking Bad. If you are normal norepinephrine and you take a drug that massively ups your norepinephrine, it can just completely mess with you. And unfortunately, some people like that feeling. They like feeling high. They like feeling super buzzed. They like feeling super powerful. They like feeling untouchable. And that's when you talk to a person who's a meth addict, that's what they're talking about. So the point here is that the only people who should be taking Adderall are the people that need it. The only people who should be taking Ritalin are the people that need it. And the reason that Adderall gets a bad rap with some people that there's concerns about abuse is that, as in other criminal activities, the people that should not be taking it are actually taking it. I have dozens of patients, hundreds of patients in my practice now where Ritalin and Adderall are the main tool that we use to help them. So you can blame it on your ADD, or you can get the help you need. And I hope the understanding of what these medicines do for you, the norepinephrine boosters, I hope you have a better understanding of Ritalin and Adderall, both really good tools and used by the right people in the right way. If you've got that condition, I say go to your primary care person, nurse practitioner, whoever does your general health care. If you don't have a doctor, go to a quick care, get a referral, but ask a doctor for help, because this is something that will rob you. It'll rob you every day if you don't take care of it. And as long as you use it responsibly, there's absolutely nothing wrong with it. I would say don't let the bias and the stigma get in your way. If you've got attention deficit symptoms, difficulty concentrating, paying attention, focusing, staying on task, ask your doctor. If you're a criminal looking for Adderall, we have ways of finding you. We'll catch you if you're lying to us. But if you're a legitimate patient, we will help you, okay? I hope this is helpful to you. I'm Dr. Dave. Thanks for coming to visit me today.